Also in our news from Canada today, the province of Ontario is proposing some new regulations that would expand the powers of some healthcare professionals in the province. Changes, for example, that would allow optometrists to perform minor surgeries, permit dental hygienists and physiotherapists to order and perform various scans. This is a proposal that would also allow pharmacists to make prescriptions for 14 additional health issues: shingles, sore throat, swimmer's ear, and more. And Linda Ward is taking a look at some of the things that we've talked about. This was the proposal as pitched and some of the response from our viewers.
Yeah, a number of responses from our viewers. We've heard from Sam Carson, who is posting on our online copy. I don't have a problem with a pharmacist prescribing some things, but I don't want my optometrist doing minor surgery or the person cleaning my teeth deciding that I need an MRI. That is going too far. We also heard Dan Patterson wrote in, great idea. I've already received shots and advice on a fungal infection from my pharmacist, but what is required to integrate pharmacists with family doctors is technology to ensure the patient's complete medical history is available to all practices. So a couple of responses there to this move that the province is considering. They're still in the consultation phase, so they're still reaching out to the various associations. The province says this will help alleviate pressures on primary care providers, walk-in clinics, and hospital emergency departments, giving them more time to help people with more complex needs. Well, the Ontario Pharmacists Association says they're on board with this. They say they're qualified. They have longer office hours than doctors' offices. Patients seem to like it, they say. And since the program launched, they say pharmacists have seen about 1.8 million Ontarians to give them assessments for some of these conditions. The Psychological Association in Ontario says patients' needs would be better met if they could provide prescriptions for certain mental health prescriptions. And we also heard from the head of the Optometrists Association, who says they are ready, willing, and able.
Right now, the optometrist can see the patient. They know what's wrong, they can treat it, but according to the laws at the moment, they cannot. So they have to refer to a specialist. And that can take months for them to have access to the care. And a lot of times it's not practical because it can be an emergency and the patient is in pain or suffering and worried, and they have to wait for the system to allow it to happen.
And he says that their people are ready to do this kind of work because they're already learning it in school. They're graduating with these skills, and others are upping their skills if they're already out in the industry. But the head of the Ontario Medical Association says this is risky. They say that a lot of these practitioners don't have the kind of training that doctors have. And this also means that there may be just too many cooks in the kitchen.
More people that you're putting into performing procedures and prescribing medications, you're actually fragmenting their care and potentially putting them at higher risk. In addition, let's be honest, there's nothing minor about minor surgeries or treating and prescribing these medications that we're talking about. These are complex antidepressants which have many side effects and can interact with so many other medications, leading to quite devastating consequences.
And she told CBC News that in her practice as an allergist, she's actually seen lots of patients who have been given medications that they've actually had adverse reactions to because they weren't prescribed by their family doctor who has a better knowledge of their medical history and things like that. So some concerns, some people pretty eager to get going on this, but no timeline from the government at this point as to when this might be ready to roll out if it does.
Lots of response to this. It's one of our most viewed, so you're welcome to write in your comments. And of course, as always, thank you, Linda. Morning Live at CBC.ca if you want to reach us and let your opinion be known on that.